The patient is placed in the supine position with the knee as straight as possible. In this instance, because of a large effusion, the knee is slightly flexed and placed upon a pillow prior to the procedure being performed. Palpate the area between the patella and the femur to identify the groove or depression, which is a useful landmark for performing the arthrocentesis. Use an inferior medial, superior lateral, or inferior lateral approach. Once the area is chosen, mark either with your fingernail or by using a ballpoint pen. In this case, a superior medial approach will be used. The area should be cleansed with an iodophor solution, starting in the center with a spiraling motion moving outward. This should be repeated at least once. After allowing to dry for 30 seconds, the area should be cleansed once with an alcohol wipe, and a local anesthetic should be administered. In this case, lidocaine is utilized. In general, a small gauge needle should be used. A small wheel is raised with the intradermal injection. The anesthetic agent may be injected subcutaneously as well. After allowing the anesthetic to take effect, perform the aspiration by inserting a syringe with a 1 1/2 inch 18 to 22 gauge needle into the palpable depression between the patella and the femur. If fluid is aspirated easily, you have entered the joint space. Fluid obtained in this example is slightly cloudy and turbid, consistent with an inflammatory condition. The amount of fluid obtained is usually small in volume and clear yellow in appearance. A moderate amount of negative pressure on the plunger is necessary to remove the fluid. After the fluid has been removed, the needle remains in the joint space, and the syringe is exchanged with one containing the corticosteroid preparation. Injection should require minimal pressure on the plunger. After the corticosteroid is injected, the needle is removed and the area is watched for any signs of bleeding.